I'm Rick Buck, and I've been a dentist for 17 years. This patient came in the other day and they wanted me to make the teeth look longer with composite veneers. Basically, they were unhappy with the length of the teeth. The young man is in high school, and I kind of explained to them a few different things on why I have a better plan. And they might not realize this, but the teeth look small because a lot of the tooth is covered by gums. And if we just expose the rest of the tooth by trimming back the gums, things will look a lot nicer. And then they can decide if they want composite veneers after we trim back the gums. So that is what we will do here today. After the patient is fully numb, we literally just take a scalpel and trim back the gums to a more ideal position. There's more to it, as you will see, but the first part is cutting or raising the gums to a more ideal gum line level. There's a part of the tooth that's called the CEJ, or cemento enamel junction. It is where the enamel crown portion of the tooth ends and the root portion of the tooth begins. Now, if you have the right instruments, you can kind of feel the junction that I'm talking about. So I'm trying to move the new crest of the gums as close to the CEJ as possible. Now, I'm also going to do something else as I'm trying to establish the correct height of the gums. I'm trying to make the highest point on the crest of the gum line of each tooth near a straight line with one another. In my opinion, that's the most cosmetic position of the gum line on the front teeth. Now you can see how just removing the gums really improves the appearance of each tooth. I show the patient the first few teeth and they are already ecstatic. So as I make the line of the gums straight, I want to explain something. Gingivectomy and crown lengthening are both dental procedures involving the gums, yet they serve distinct purposes. A gingivectomy entails the surgical removal of excess gum tissue, often to treat gum disease, reshape the gum line, or enhance the appearance of the teeth. This procedure focuses primarily on removing diseased or overgrowth gum tissue without altering the underlying bone structure. In contrast, crown lengthening involves the removal of gum and bone tissue to expose more of the tooth's surface. This is typically done to provide better access for restorative treatments like dental crowns or veneers, or to address aesthetic concerns like gummy smile. While both gingivectomy and crown lengthening involve manipulation of the gums, gingivectomies primarily target excess tissue, whereas crown lengthening adjusts both gum and bone levels to achieve specific functional or cosmetic objectives. This is important because gums normally just follow the underlying bone. So if you only remove gums by doing a gingivectomy, they may just go right back to the same position in the following weeks and months. So when I do gingivectomies for cosmetics, I do a little bit of a hybrid of gingivectomies and crown lengthening, and you will see me doing it now. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. See, I take this instrument and I put a lot of pressure on the underlying bone. You see, the crest of the underlying bone is thin and fragile. If you put pressure on it, you can actually migrate the crest of the bone upwards. As the crest moves upwards, the gums are much less likely to go back to their previous location. I put quite a bit of pressure on that bone, and once the tissue is cut back, I kind of smooth the gums with a burr in my surgical handpiece. It helps to remove any straggler gum pieces, and I go all the way around the bone level to do this. So next, I then take out Viscostat to get the gums to stop bleeding. Now, this is quite effective at stopping the bleeding, but has a couple of downsides. First, Viscostat tastes horrible, so I take care not to get it everywhere when rinsing it out. The second issue is that it turns the affected gums black and brown temporarily. This will actually last a few days, but I have to use it for the next step to be effective. You see, gums are amazing at healing, but they do not like foreign materials. They will move away from fillings and crowns if they are too close. So one way to stop gums from growing back is just putting a little bit of bond that we use for white fillings near the gum line. This will signal to the gums as they're healing to not grow back in this location. To do this, I etch the teeth with phosphoric acid and rinse that away. Then I just put a very thin layer of bond on the teeth. I use my curing light to set the bond to the tooth, so this is what they look like at the end of the appointment. The gum line is much more ideal, and the tooth looks like a full tooth compared to what it was before. The question is, what will it look like once it heals? So here is what they look like 2 weeks later. The gums have healed quite a bit, and in fact, they are still healing because they need more time to fully heal. They obviously took quite a beating during that procedure, but this is around where the new gum line level will be. If the patient wants anything more than this, the patient will need to do an actual crown lengthening procedure. In this case, my patient is completely happy with the results, as you can see with the before and after footage, and he no longer even wants any sort of veneer. And mom says he's smiling with confidence now. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.